Good morning, and thank you for being here. We're here today to discuss SB 38, our Silver Alert legislation that will help save the lives of our loved ones. Every year, many seniors with Alzheimer's disease or other forms of dementia walk away from home and are never seen again. Unfortunately, California does not have an integrated system to promote the recovery of seniors who wander away. Today, according to the Alzheimer's Association, almost 600,000 individuals in California have Alzheimer's disease. And I know that number is truly astounding to all of us. And 1 in 8 seniors 65 or older has Alzheimer's, or 13% of the population. By 2030, the number of seniors with Alzheimer's will increase to more than 1.1 million. This is an issue, probably in the beginning should have said I'm Senator Elaine Alquist. I chair the Senate Health Committee and also the Subcommittee on Aging and Long-Term Care. And I think because my dad was born in 1906, my late husband in 1908, my mother in 1912, I have a particular interest in aging issues. And being 64 years old myself, I include myself in that cohort of people who are rapidly getting older if we are lucky. So another alarming statistic is that the Alzheimer's Association estimates that 6 in 10 people with Alzheimer's will wander away from their home or care facilities at some point. 6 in 10. That translates into 300,000 individuals today, a year, and by the year 2030, it will be 660,000 individuals per year who wander away from home. Because of Alzheimer's particularly debilitating features, these individuals are vulnerable to disorientation. They are at extreme risk for serious injury, or they can die from the heat or cold if they don't make it home within the first 24 hours. That's why I am presenting SB 38 this morning to the Senate Public Safety Committee in room 4203. SB 38 would enact the Silver Alert Act, which would require a public alert system to be activated if a person 65 years of age or older is reported missing and has an impaired mental condition. This is similar to the extremely successful Amber Alert. Law enforcement agencies would work with broadcasters and other intermediary emergency agencies that may institute activation of the system. I'd like to share with you what some other states are doing. To date, 18 states have established a Silver Alert program, and then 14 other states, including California, are considering Silver Alert legislation. The federal government recognizes that this is a public safety problem that is only going to get worse. There is a bill currently working its way through Congress. If enacted, the federal legislation would create a national coordinator of the Silver Alert Communications Network at the Department of Justice. It would establish federal block grants to the states totaling $10 million per year through 2014 to help us enact the system, which is especially good in this down economy. As you can see, this is a very important bill, and I am pleased that a very good friend of mine and a very fine senator, Senator Lou Correa, is a joint author. And Senator Correa, would you like to make some comments?
Yes, thank you very much.
Yes.
Thank you, Madam Senator. I'm State Senator Lou Correa, and I'm part of the sandwich generation. I've got children, and I also have parents that I take care of. And I'll tell you, parents don't like to be taken care of. Let's make sure we understand that. They don't like to be told what to do, yet we love them. They are part of our family. And you think about this Senate Bill 38, this effort, it's really common sense. And the first question I got to ask is, why haven't we done this sooner? Why didn't we do this before? You have a child that's missing. All of us put our hearts and effort into finding that child. And we have a senior citizen that's close to us, that's missing, that we understand has been gone. Why haven't we instituted a Silver Alert for them as well? This is just common sense. I'm glad We're bringing it up now. We have to make sure this happens. And if I can digress a little bit, remember when I was in college back at UCLA, and I remember in Westwood one day we saw this gentleman, senior citizen, clearly disoriented. We stopped him, said, "Can I help you? Are you okay?" Ask him a few questions. Are you all right? Are you okay? Do you know where you're going? The only answers we got from him were yes, yes, yes. An officer came by. Are you okay? Yes, yes, yes. And to this day, I look back and I wonder, was he really telling us yes, 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 or was he really saying, "I'm not sure, I don't know"? I'm hoping this is a start of a major effort by us as a state to make sure that we recognize that senior citizens like us, like me, like my children, sometimes can have mental challenges, and we have to make sure that we address them in a proper way. In short, this is changing our state of mind, our mental attitude, our predisposition when it comes to our senior citizens. Thank you very much, Senator Alquist, and I'm very happy to join with you in this very, very critical effort. Thank you very much.
Thank you. Well, I am probably one of those stubborn parents. And I think it's really important that we educate all families, our seniors, children, to understand that, you know, if we live a long life, which many of us will, a large percentage of us will end up with dementia and possibly Alzheimer's. Now, my goal is to see that down the line that we certainly come up with a cure for Alzheimer's, and I think that is possible, but we're not there yet. And so it's important for families to understand that it's all right to talk about this disease, and that if a family member wanders away, it's important for them to alert the police and to find that person who has wandered away. And with that, I would like to introduce Sherry Pruitt, whose mother had Alzheimer's disease and who's had several terrifying occasions where her mother wandered away from her care facility. Sherry?
Thank you, Sam. Thank you very much. Thank you. Thank you, sir. Thank you. Good morning. My name, as she said, is Sherry Pruitt, and I was a caregiver for my mother who lived with Alzheimer's for 7 years. When asked to speak before you, I had very mixed emotions. Families that have members with dementia go through so many different experiences that you never know where to begin. So I just briefly want to tell you about the most frightening experience that I had with my mother the day she wandered away from the home where she lived. I had first noticed something different about how my mother was acting, not remembering who she was, where she was, or who I was at times. I decided to take her to the doctor. He said she had the beginning stage of Alzheimer's and that she'd be okay and that it would work very slowly. We soon found out it was moving faster and her memory was going very, very quickly. I moved her into an independent living facility first. Then we had to move her into an assisted living facility. She quickly learned from the assisted living that she could slip out a back door. And before we know it, she had decided to take a walk. No one at the facility even noticed that she had been gone for a couple hours. By then, she had gone to a store about 4 blocks away, and I'm talking long country blocks. She could never find her purse. She always put it someplace, so she never had identification on her. When she came out of the store, she was confused, turned around, and she asked a total stranger for help. The young girl took her to her home because my mother could not tell her where she lived. The young girl called the police for help. The police came, and they saw that she had no ID on her. They tried to ask questions to no avail. They started looking near the store where my mother asked for the help to see if they could find elderly facilities. If any of you are familiar with Walnut Avenue, there are about 6 to 8 facilities for the elderly in that area. They drove back and forth to each one of these homes asking if they were missing someone when finally they came upon the home where my mother was. Shortly after this incident, we moved her to a home that had a locked campus with monitoring devices so that she couldn't get out. While all this was going on, I was out of town, and it took the assisted living facility 2 hours after my mother was first reported missing to get a message to us. It took a total of 6 hours from the first point of her being missed until she was found safe and returned to the home. My long drive back was filled with many emotions about how my mother would be found and whether she would be alive and well. We were really blessed that day. Someone was looking out for us. The young girl who found her and helped her was a good and kind individual. Our outcome was a happy one. It could have been bad and very tragic for us. God blessed our family that day. No one should have to spend hours waiting for the time to pass that gives the police the ability to take action. The police don't consider a person missing until 24 hours have passed. Setting up a silver alert system would give police the ability to start searching as soon as an elderly person with dementia or Alzheimer's is reported. This could mean the difference between someone being found safe or being badly hurt or even dying. Thank you for listening to my story. I hope the legislature will pass the SB 38 so that other families will have more support when they lose or miss or a loved one gets out and gets lost. Thank you.
I know that was difficult for Sherry to talk about, but that's the reality of what happens when someone with Alzheimer's wanders away. And you can understand that if the person is not found quickly, that anything can happen. And Sherry and her mom were lucky that it was a good young woman who found Sherry's mom. And next, I would like to welcome Jackie McGrath, who is the State Public Policy Director for the Alzheimer's Association, and as we know, has done so much on Alzheimer's. Thank you.
You are much more likely to hear about a missing child, as Senator Correa referenced. But the reality is that there are far more elderly suffering from Alzheimer's and related dementias that go missing. You heard some pretty startling numbers from Senator Alquist. I'd like to give you some that are a little more startling. We released a report last month that actually is looking at people living with this disease 55 and older, because the reality is this disease is not just diagnosed when people are old and frail, that in fact it is being diagnosed much earlier when people are much younger. So today there are more than 588,000 Californians living with Alzheimer's. Of that number, more than 350,000 will go missing from wandering sometime during the course of that disease. Most people with Alzheimer's are found who wander are found within 1.5 miles of where they left, like Sherry's mother. But even if they are close to home, if an elderly person with Alzheimer's is not found within 24 hours, there is a 50% chance that they will be seriously injured or die. Yet today, families have one option: to call 911. And more likely, they will be told by the police that the person is not really considered missing until 24 hours has passed. When you have dementia, every minute counts. Because the person won't have the cognitive ability to do all the things that you and I take for granted, to ask for help, to try to stay warm if it's cold, to even remember to eat or drink. They are incredibly vulnerable. You add to that the fact that most people with Alzheimer's also have one or two other serious chronic conditions, like diabetes, high blood pressure, heart disease, all things that require regular medication. Wandering is such an unlikely symptom of a medical diagnosis. It's a common term that most of us use and have never particularly associated with putting someone at risk or harm. Families are usually caught off guard when the person with Alzheimer's wanders, even if that family has done everything to educate themselves as to what to expect. It just is never expected when it happens. Sometimes the person is still in the early stages of the disease, or so the family thinks. Sometimes they're even driving. Just 2 weeks ago, a 67-year-old man in Anaheim went missing. He left home to get gas. He was last seen filling up his blue Chevy Camaro. He didn't return. His family reported him missing. 3 days later, he was found when he was returning from Mexico. At the border, guards could tell that he was really confused and stopped him, and subsequently found that he had in fact been returned or been reported missing. That story had a happy ending, but I can't even imagine the anguish over a 3-day period. Sherry has told you about hers over 6 hours. Caring for someone with Alzheimer's takes a severe toll on families. This disease can last 7 years, 10 years, even more than 15. Families need all the support they can get. Establishing a silver alert system in California will go a long way to giving families a support system for one of the most agonizing and anguishing experiences anybody can have, and that is having a loved one go missing.
Thank you, Jackie. Last, we have our co-sponsor and good friend, Joe Murphy.
Thank you, Senator. Good morning. I'm Joe Murphy. I'm a senior senator in the California Senior Legislature. I first came across this subject, as Senator Correa so aptly stated, about the beginning of last year. I saw an article about this, and as I read through it, I said, where is California? California is always a leader, and there's no mention and no indication whatsoever that California is taking any action in this dire need for these seniors. My dear friend, Senator Alquist, has always been the greatest advocate for seniors and has always been strong on Alzheimer's, was gracious enough to take this bill. I introduced the proposal in the senior legislature last October in our annual session. I was successful in garnering unanimous support from both houses, who represent over 6 million seniors in the state of California, and it was also adopted as a top priority for our seniors to be carried to this session. As I said, Senator Alquist was gracious enough to author it. In fact, she was ready for it while our annual session was going on. She was anxious to get this in and get it moving. My co-author, Senior Assembly Member Terry Sonnefeld, also shared with me in getting this accomplished. I first really got involved with Alzheimer's over 10 years ago when I was training to be a long-term care ombudsman. My wife and I were a team. And the Northern California Alzheimer's Society gave a presentation, and I took him aside and I said, what's your problem? He says, 7 years we've been trying to get training for people in Alzheimer's in facilities, and we've never been accomplished. I said, well, let's do it, and I was successful in getting 3 bills passed to get training into residential care facilities on how to treat Alzheimer's in nursing homes and expanding their knowledge of Alzheimer patients and even in the medical field. So This is a very important issue to me, and when I was a long-term care ombudsman, I visited homes, nursing homes, and residential homes, and as our witness stated, they have locked facilities, but I can tell you that's not an absolute guarantee because sometimes they slip out of there too. Maybe somebody comes to visit and doesn't quite shut the door, but I saw events where locked facilities people escaped from. I also authored in the senior legislature a resolution to have California get behind this effort in Washington to adopt the nationwide coordinated effort. And Senator Correa was gracious enough to author that into this session. And it's wonderful that we have such great support over here. This is an extremely vital thing, as has been said. You know, how can I repeat everything that's been said? But that first 24 hours is critical, and it's something got to take place immediately to save these people from injury or death. Thank you.
In closing, let me just comment that we can join federal efforts in other states in establishing the Silver Alert program for California's 500,000 seniors who have Alzheimer's. You give families a peace of mind. SB 38 will be heard this morning in just a few minutes in the Senate Public Safety Committee in room 4203. And just one or two last comments. No one in my family has ever had Alzheimer's, but I've been in enough hospitals and nursing homes over my lifetime with loved ones to understand what a horrible situation it is for families. And I believe that this is the most basic of bills that needs to be passed by this legislature. People who live a good life and work hard in California ought not to go out and die because they've wandered away from home and no one found them in time. There is a simple solution. There is already a network in place with the Amber solution, with the Amber Alert, and I have a great hope and desire that this legislation will be passed. I want to thank Senator Correa for his great efforts in this area and for all the advocates who've made a difference, and thank you for being here. Thank you.
Senator Alquist, I hate to have to ask this, but how much do you reckon the Silver Alert program would cost in California, and who would pay for it?
Well, two things. One, as I mentioned, there's an effort at the federal level right now in Congress, and if that is passed, that could probably cover all of it, and that's S557. The other piece, so that's a huge thing that the federal government would be funding it. And then the other piece of it is there's already a network technology-wise in place with the Amber Alert. So I really don't think this should cost any money.
So,
I might have a discussion about that in appropriations, but I don't think there should be a cost to it.
But you anticipate that the federal grant would be enough to cover
Yes.
the cost. Now, would that be?
And if it's not, well, then we'll have to put our heads together again. But because there's already the Amber Alert in place, when I think about what goes into the Amber Alert, the technology system for that, it would be almost identical for the Silver Alert. It's just a different group of people. Instead of children, it's seniors. I also want to mention this wonderful logo that my staff, and I think, Russ, did you develop this? The caucus did. Well, thank you to the caucus. I think in closing, this is the kind of bill that should have been law probably 10 years ago, and certainly is greatly needed now. Thank you. And I'd be glad to take one or two questions privately. Of course.
Don't forget also, it's not just about the cost.
Go ahead.
It's not just about the cost, but it's the cost savings. You have a senior citizen who wanders and you're away from where they're supposed to be. You're able to get them back safely versus not getting them back after the first few hours and heaven forbid something catastrophic happens to them. What are the costs of, first of all, the medical costs. Number two, the costs of public safety, the officers looking for this individual. So again, let's look at the cost benefit. I think the savings more than outweigh any of the insignificant costs of setting up the system.
And I just want to be clear on this too, because before I started doing this, I used to work in a radio newsroom, and we would pretty routinely get at-risk missing elderly person alerts from SAC police or SAC sheriff or whatever. And I honestly don't remember if those had already been 24 hours out before they sent them. Perhaps they were, but maybe you could talk a little bit about, I guess I'm kind of, I'm sad to hear that law enforcement is not cooperating with trying to find an at-risk missing elderly person who's got some dementia issues, that law enforcement would say, no, we have to wait 24 hours to look.
Well, as a woman who was the first woman to chair the Senate Public Safety Committee, and has worked with public safety a lot, I really admire what they do. I will also say that they have a full plate and no funds. And so you have to set limits on what you can do. And that is why we have this legislation. And there, hopefully it will be funded by the federal government. That will allow money to locals and to the state to do the system. As you say, you would think it was something that was probably done already because it's such a gut-wrenching issue of seniors, our parents, our grandparents, wandering away from home. I know of cases where people have, walked out at 4 o'clock in the morning and, got hit by a car on a street. And as Senator Correa said, there are really cost savings, human and otherwise, to putting this into place. So thank you for being here. We appreciate it.
Let me add to
Sure.
that as well. It's not an issue of cooperation. I believe, like Senator Alquist said, public safety or officers are doing the best they can with the resources they have, but it's more of a state of mind of us as a society. You think about what we've done last year, for example, here. We passed a number of legislative items to deal with autism. How do you deal with kids with autism that are now becoming adults? Now, here today, we're talking about senior citizens over 65 with mental challenges. How does a peace officer, but not only a peace officer, we as a society, when you see somebody that's out there disoriented, do you just say, are you okay? And do you wait for the nod, yes, I'm okay? Or do you take the time to make additional inquiries and make sure you get this person to a safe place? And it takes, as a society, a change in attitude. And I think this is what we're looking at right now, the beginning of that here in the state of California, and hopefully nationally as well.
Thank you. I will have to present this bill in public safety pretty soon. Thanks.